Welcome back to Medquest Digest. This is our weekly case series in which I'm going to go over high-yield USMLE and COMLEX cases for you. Let's start with our first one for this week, and that is you have a 34-year-old female who has abdominal pain, and she says, I've noticed my stools have become very dark. In fact, they almost look like tar. She is a runner, and she has knee pain, and she uses ibuprofen regularly, if not even more regularly than she should, for the pain. When I ask her about the pain, she says, listen, it's right over here, over my epigastrum. It kind of hurts a little bit. It gets worse when I eat. I'm not eating because it's so painful. And when you actually palpate the area, it's tender too. So you do a rectal exam and it shows guaiac positive stools or heme positive stools. Labs show a hemoglobin of 10.9 grams per deciliter. So she gets sent for an endoscopy. And it shows a clean-based white ulcer, and biopsies are positive for H. pylori. And there you can see all those little H. pylori just kind of floating around on this biopsy. Now they've told you the diagnosis already, that she has a peptic ulcer, she's inflamed because she has H. pylori, and she concomitantly was using NSAIDs, which is another cause of ulcers. The only other cause left besides H. pylori and NSAIDs is malignancy for stomach ulcers. So what are you going to ask? Well, they're going to ask you which of the following is the appropriate next step in management. Well, obviously, we're going to tell the patient don't use NSAIDs anymore because they're going to make you more likely to have an ulcer. But then you see the choices are 3 sets of sort of antibiotic combinations with some acid blockade, who knows what that's for, or repeat the endoscopy in 6 months, or do nothing. Well, you and I both know I'm playing around. What we have to do for this patient is we have to treat the H. pylori. The way we treat it, a variety of combinations. This particular case, we're going to use clarithromycin, amoxicillin, and a proton pump inhibitor, such as any of them. They're all the same, whether it's pantoprazole or lansoprazole or dexlansoprazole, whatever they might be, they're all the same. And you're going to use those for 10 to 14 days. You don't need to repeat the endoscopy now or tomorrow or in 6 months unless there's a clinical change, because it's a clean-based ulcer. They have a very low rate of bleeding again, and they heal nicely after you take care of the NSAIDs, meaning you get rid of them, take care of the H. pylori, and you give them a PPI for long enough so their stomach heals. So she gets treated. She's feeling better. What do you do now? Well, if you're following along, and if this is step 2, your case might end. If it's not, and there's a follow-up question, they may say she comes back 4 to 6 weeks later. On step 3, they may ask you, have you send her home and bring her back in a month on CCS? The point here is they want you to do eradication testing. And there are 3 ways to do eradication testing. You can repeat the endoscopy and do biopsies, but that's a little overly invasive. The other option is you can check a stool H. pylori antigen, or you can do urea breath testing. You do that anywhere between 4 to 6, sometimes even 8 weeks after the initial diagnosis and treatment's completed. If those tests, the stool or the urea breath test, are negative, nothing to do. If they're positive, you're going to retreat the patient for H. pylori. The most common wrong answer at this point is to check a serology, meaning an H. pylori antibody. Remember, it's an IgG. That means it's positive for life. Once it's positive, you keep it forever, like luggage. You ever see people who never get rid of their luggage? Same thing with an H. pylori antibody. And so therefore, checking the antibody will not tell you anything. It's always going to be positive. Same thing is going to tell you when you have an initial diagnosis. You don't know about the person's previous treatment. So you don't know if that IgG positivity is from an old infection or from a new one. All right, folks, that's it this week from Medquest Digest. Keep a lookout for these cases in our Step 2 Q-Bank, as well as in our best-selling Master the Wards flashcards, available now at your favorite bookseller and retailer. I'll see you next week.